Investigation questions earlier claims of protective gene variants against Alzheimer's disease. This is Planetterrian Daily, episode 151. A science investigation examined prior claims of gene variants said to protect against Alzheimer's disease. The report probes the strength of evidence behind those reports and their influence on biotech programs. It highlights inconsistencies in the original data. Follow-up work will need to clarify which variants, if any, show reproducible effects in independent cohorts. Now, shifting to a very different area of research. Researchers from Weizmann, Carnegie Mellon, and partner groups outline an approach that integrates models across molecular, cellular, and organism scales. The framework is presented as a route to better prediction of biological outcomes. Integration of these layers is described as essential for translating basic findings into practical interventions. Next steps include testing the combined models against experimental datasets. From computational integration of scales to practical ways people can already modify daily movement patterns, the study examines how brief bursts of high-intensity effort within routine exercise sessions affect health markers. Separate analysis of stair climbing shows similar associations with improved cardiovascular measures. Both approaches are positioned as accessible modifications rather than entirely new regimens. Further trials will test whether these patterns hold across broader populations. From individual movement choices to the broader role of social connections in shaping health outcomes, a large international study finds strong links between close social relationships and both physical and mental health measures. Participants reporting satisfying friendships showed consistently higher ratings on well-being scales. The pattern held after accounting for demographic variables. Researchers note the need for longitudinal data to clarify direction of effects. Reports indicate that adolescents are turning to AI chatbots during nighttime worry episodes instead of waking parents. The accounts describe both potential benefits for immediate access and risks around accuracy and privacy. Guidance for parents and developers centers on verification steps and clear limits. Ongoing monitoring will track how usage patterns evolve with newer models. The pattern appears concentrated in evening hours when professional support is least available. Developers are being urged to embed basic safeguards before wider rollout among younger users. From human social patterns to microbial communities where viruses help maintain balance. The work describes how certain bacteriophages use targeted mutation regions to adapt quickly to bacterial differences. These viruses help maintain balance in the microbial community rather than causing disease. The mechanism offers one route by which the virome influences bacterial populations. Future studies will map how these dynamics shift with diet or antibiotics. Argonne National Laboratory researchers combined inorganic materials with biological components to raise production efficiency. The hybrid system uses sunlight to drive the reaction without additional chemical inputs. This design improves yield compared with purely inorganic or biological routes. Continued development will focus on scaling the material for practical applications. The model shows how light scattering can be suppressed in chosen directions even without ordered crystal structures. It moves beyond traditional photonic crystal approaches to irregular arrangements. This expands possible materials for controlling light in sensors or imaging devices. Experimental tests of the predictions are the immediate next phase. Structural features of vaccine components determine how long immune cells and antibodies persist. Researchers are testing modifications that promote longer-lasting memory responses, particularly for HIV candidates. The approach focuses on antigen presentation rather than adding new adjuvants. Clinical testing will determine whether these changes improve durability in humans. Observations 2 years after the federal guidelines overhaul show uneven change at methadone clinics. Updated federal guidelines reduced some rigid dispensing requirements for opioid treatment programs. Some clinics have relaxed scheduling while others have maintained prior practices. The variation affects patient access and retention. Continued tracking will assess whether broader adoption narrows these differences. Clinics that kept older rules cite concerns over safety and regulatory clarity. An opinion piece notes that US and UK health systems share an over-reliance on biomedical fixes. The piece argues that clinics and hospitals increasingly absorb costs tied to social isolation and related problems. It contrasts this pattern with earlier emphasis on community-level prevention. The author calls for policy shifts that address root social contributors. Implementation would require coordination across health and social service agencies. Both systems are described as defaulting to individual medical interventions even when social factors drive the underlying need. The project explores how ant behavior or physiology can inform agricultural practices. Details center on practical applications derived from field observations. The work is positioned as a low-cost method suitable for regional use. Further validation will test performance under varied growing conditions. Researchers resolved confusion between Pristimantis milpae and a similar species by examining 19th century specimens in London. The newly described frog is both abundant and widely distributed in Ecuador. The study illustrates how historical collections continue to yield taxonomic clarity. Additional surveys will map the full range and habitat needs. A Bournemouth University study finds that a small subset of ospreys nesting away from established colonies drive faster range expansion. These pairs establish new sites that later attract additional birds. Conservation strategies may prioritize protection of such early colonizers. Monitoring will determine whether this pattern repeats in other raptor species. July 2026 fires exposed populations across Canada and the northern United States to elevated particulate levels. Peak periods saw moderate or worse air quality affecting hundreds of millions of person days. Toronto recorded some of the poorest readings globally during the event. Public health agencies are reviewing alert systems for future episodes. The science investigation re-examines earlier reports of gene variants claimed to protect against Alzheimer's. It finds weaknesses in the supporting data and questions how those claims shaped ongoing biotech efforts. Independent replication and larger cohorts will be needed to settle which variants, if any, show reliable effects. Most people assume light mainly disrupts health by interfering with sleep timing. In reality, certain wavelengths directly influence hormone systems even when sleep itself remains intact. Right now, as you sit under indoor lighting, photoreceptors in your eyes are sending signals that can alter melatonin and cortisol rhythms through pathways separate from the sleep centers. Studies have documented consistent endocrine changes across individuals who experience different light exposures at the same sleep duration. One practical step is to reduce bright overhead lighting in the hours before bed while keeping sleep schedules steady. Watch for upcoming field studies that separate light timing from sleep metrics to quantify the independent contribution of each factor. Before we go, keep an eye on further tests of the multi-scale modeling framework against new experimental datasets. That covers today's science and health news. Share this with someone who's curious about the latest research. I'm Patrick in Vancouver. See you next time. And if you'd rather watch than listen, find us on YouTube at NERA Network. Links in the show notes. One more thing. If you liked today's episode, our sister show First Principles Daily is worth a spot in your feed. Reasoning from raw materials, not analogy, on the breakthroughs that actually cut cost. It's one of the NERA Network's daily briefings, all free at neranetwork.com. Prefer reading? Today's full write-up, sources, and transcript are on the episode blog at neranetwork.com. Same briefing, readable format. This episode used AI voice synthesis of my voice. Editorial selection and analysis are my own.